Good morning. We are back to our routine. Today's subject is a very important one as it's widely prevalent all over the world and it is misrepresented in terms of the number of patients involved. It's about mental health disorder and it's a general term for a group of illnesses that may include symptoms affect the person thinking, perception, mood, and behavior. It can make it difficult for a person to cope with work, relationship, and other demands. It is very common, although it is underestimated. Generally, statistics show that 1 in 5 adults has mental problem at some stage in their life. It can happen at any age from childhood to adulthood. The mental illness can be temporary or long-lasting. You may also have more than one problem at a time, like depression and substance abuse. The difference between normal mental health and mental disorder, sometimes the answer is clear, but often the distinction is not so obvious. For example, if you're afraid of giving a speech in public, does it mean you have a mental disorder or run-the-mill case of nerves? Or does shyness becomes a case of social phobia? Here is help understanding how mental health conditions are identified. Overall, it is the wellness of how you think, regulate your feeling and behavior. Sometimes people experience significant disturbance in this mental functioning. It can present when a pattern or change in the way you think, you feel that causes distress or disrupt the patient's ability to function. It may affect you in many ways. It can affect you in maintaining personal, family relationship, function in social setting, perform your work at school, learn at the level expected for your age and intelligence, participate in other normal activity. Cultural norm and social expectation may play a role in defining mental disorder. There is no standard across the culture to determine whether the patient is normal or not. What might be normal in one society could be not normal in another. There is the Diagnostic and Statistical Manual of Mental Disorder, which is a guide published by the American Psychiatric Association that explains the signs and symptoms of several hundred of mental conditions, including anxiety, depression, eating disorders, post-traumatic stress disorder, and schizophrenia. It makes the diagnosis based on the nature, the duration, the impact of signs and symptoms. It also describes the typical course of a problem, risk factor, and common coexisting condition. Another commonly used diagnostic guideline is the International Classification of Disease of the World Health Organization. Health insurance companies use that ICD and DSM in determining coverage and benefits to reimburse the poor healthcare professional. A diagnosis of a mental condition should be made by psychiatrists, psychologists, social worker, and other mental health professional, and primary doctor is of extreme importance. The diagnosis should be based on medical history, previous illness of mental disorder, complete physical health, rule out conditions that might be causing symptoms, questions about current status and concern and why, questions about how recent event or changes in your life, whether it's traumatic, relationship, work, death of a friend or relative, have an effect on you, questionnaire or other non-formal test that can ask your feedback on how you think, you feel, and behave in certain situation. Question about past, current problem and drug use, history of trauma, abuse, family crisis, other major event, and questions about past or current violence against yourself and other, questionnaire involving other problems. Each mental health condition has its own signs and symptoms. In general, however, professional help might be needed if you experience any marked change in personality, eating, sleeping pattern, inability to cope with a problem or daily activity, feeling of disconnection and withdrawal from normal activity, unusual magical thinking, excessive anxiety, prolonged sadness, depression, apathy, thought or statement about suicide or harming others, substance misuse, extreme mood swing, excessive anger, hostility, and violent behavior. Many people who have mental health issues consider their signs and symptoms as part of normal life or avoid treatment because of embarrassment or shame about the condition. The prevalence of mental health problem, it is based on the diagnostic DSM and surveys that include supplement the NSCA, lifetime prevalence among U.S. adolescents between 13 to 18 estimated to be 49.5% have a problem of that disorder. Of adolescents with mental health issue, estimated 22.2% have severe impairment and distress. The DSM-4 criteria used to determine the level of severity. There are estimated 14.1 million adults age of 18 or older in the United States have this problem. This number represented 5.5% of the U.S. adult. Prevalence of the mental disorder is higher among female than male. I think hormonal issues play a part in that. Young adults had the highest level of a problem. It's 11.4 compared to adult age between 26 to 49, which is 7.1%. Age of 50 and older, 2.5%. Prevalence of this disorder, among others, followed by reporting two more races. The Native American is about 9.3, and other two races is about 8.2. Mental problem is lowest among the Asian adult. Based on diagnostic interview from National Comorbidity Survey, the lifetime prevalence of mental disorder among U.S. adolescents 13 to 18. Screening for mental health. A mental health screening is a standard set of questions that a person answers to help the health professional to diagnose or to check for signs of mental problem. Questions help the provider learn about person's mood, thinking, behavior, and memory. Mental health screening is a way to catch the issues at early stage of the disease. If the screening shows signs of disorder, more testing needs to be done and referral to the psychiatric or psychologist or any the health professional required. More than half of all Americans have the mental health issues. Their symptoms may range from mild to severe. The common health disorder are mood disorder, range between depression, bipolar, anxiety, eating disorders, attention deficit disorder, in children particularly, and it can happen in adulthood, post-traumatic stress disorder, personality disorder, substance abuse. The risk factors, certain risk factors may increase your risk of developing mental health issue. And in doing the history of mental disorders in relatives, blood relative, particularly parent or sibling, stressful life situation, financial problem, death of loved one, divorce, and ongoing chronic medical condition like diabetes, brain damage as a result of serious injury to the brain, traumatic experience like military combat or assault, the use of alcohol or recreational drug, childhood history of neglect, few friends or few healthy relations, previous mental health illness. The causes of mental health in general are thought to be caused by a variety of genetic and environmental factors. First of all, it's an inherited trait. The second is environmental exposure before birth. Third is brain chemistry. This is a recent theory of neurotransmitter naturally occurring in the brain chemical that carry signals to other parts of the brain, and when these neural network involving these chemicals are impaired, function of nerve receptors and nervous system change, leading to depression and other emotional disorder. The signs and symptoms of mental illness can vary between one another. Examples being feeling sad or down, confused thinking, reduced ability to concentrate, excessive fears and worries, extreme mood change, withdrawal from friend, and significant tiredness, low energy, problem sleeping. Withdrawal from friend and activities, significant tiredness, detachment from reality, delusion, paranoia, and hallucination, inability to cope with the daily problem stress, trouble understanding and relating to others, problems of drug, alcohol, major changes in eating habit, reduced sexual drive. As we spoke about, withdrawal from friends, changes in sex drive, significant tiredness, fatigue, major mood changes, major changes in eating habit. The diagnosis, this is an important issue. Patient comes with a complaint, or the relatives, family, bring the patient to the doctor complaining of certain problems. One is very important to look into the medical history, complete medical history. Family history is extreme importance. Complete physical examination to identify a physical condition that could lead to symptoms. Questions about current concern or why the patient is seeking help. Questions about recent events, changes in your life and trauma, relationship, a problem, work, death of a friend. Then questionnaire or other formal test to ask for your feedback on how you think, feel, or behave in certain situation. Question about past, current alcohol use, drug use, history of a trauma, abuse, family crisis. Questions about past, current thoughts, and violence in the family. Each mental health condition has its own sign and symptom. In general, however, professional help might be needed if you experience marked change in personality, eating, sleeping pattern, inability to cope with the day-to-day activity, feeling disconnection and withdrawal, unusual magical thinking, excessive anxiety, prolonged sadness, depression, apathy, thoughts or statements about suicide, substance misuse, extreme mood swing, excessive anger, hostility, and violent behavior. Many people who have mental health disorder consider their signs and symptoms as part of normal, probably because they are trying to avoid seeking help due to shame or fear. If you are concerned about your mental health, don't hesitate to take advice. In diagnosing mental health condition, each one has its own signs and symptoms. Professional help may be needed. I guess we spoke about this. If the patient shows marked change in personality problem, daily activities, sleeping disorder, aggressiveness, anxiety, magical thinking, substance abuse, extreme mood swing, excessive anger, violent behavior. Many patients do not declare these symptoms and try to regard it as normal, as a part of fear or shame, but advice is to seek mental health help as soon as you find any problem. The way to diagnose mental health problem it's composed of different compound. First of all, the full medical history, the examination, the symptoms of the patient, and then we have the depression test questionnaire. And in that test, we do ask about over the last 2 weeks how often you've been bothered by the following program. And each item has its four categories: not at all, mildly, moderate, severe, that type of thing. So we're going to take them one by one. Loss of interest or pleasure in doing things, feeling down, depressed, and hopeless, trouble falling or staying asleep or sleeping too much, feeling tired, having little energy, poor appetite or overeating, feeling bad about yourself, that you're a failure and you let your family down, trouble concentration on things such as reading newspaper or watching TV, moving or speaking so slowly that other people can notice, thoughts that you would be better off dead or hurting yourself. Now, a check of any of these problems and how difficult it is and how it is interfering with your day-to-day life is very important, and talk to your healthcare professional. The treatment is multiple issues that has to be treated. Each case dictates its own merit and depends on many issues. Generally, the mental health issues are between antidepressant and psychotherapy, but there are patients who require hospitalization. Others can do an outpatient. Medication also varies. I will stop it here because this part is left to the discretion of the healthcare provider and the expertise of the psychiatrist in dealing with these cases. Thank you for listening.